I'm really pleased to be joined here by Wendy Mitchell, best-selling author, blogger, and member of our Young Dementia Network steering group. Wendy was diagnosed with young onset dementia at the age of 58, and since her diagnosis has worked to raise awareness of young onset and written 2 best-selling books based on your experiences. So today, our webinar, Janet and Michael will be discussing the recent prevalence data that estimates that 7.5% of people currently living with dementia were diagnosed under the age of 65. This is higher than the prevalence figures we've had before. So Wendy, why do you think it matters to have a better understanding of the number of people living with young onset dementia?
Well, if you'd pardon the pun, it's a no-brainer. Why would you not want to know how many people you have in your area with young onset? Otherwise, how do you know what services you need to provide? To know the figures more accurately enables commissioners to make best use of their money, their finances, because young onset, those with young onset need so much different support than those of an older age, because they're working, they have mortgages, maybe they have young children, they have far different needs than those in the older age group, which are just as important, but young onset is just as important as well.
Absolutely, absolutely. And the prevalence data was obtained from a review of GP records, looking at diagnosis date and the age at diagnosis. There are many different things that can have an impact on what happens during the diagnosis process. And this can affect the number of people getting a diagnosis. What changes would you like to see in terms of the experience of diagnosis for people with young onset dementia?
Well, my advice actually costs nothing. My advice is the best thing clinicians can do is to change their attitude towards diagnosis, to change their attitude from concentrating on what they can't do and what we can't do, and instead using their skill and expertise to diagnose young onset, but then concentrate on the person in front of them and concentrate on what they can still do, not what they can't do. Because to receive a diagnosis is a devastation for anybody, but it's the way you deliver it that can make or break that person. And to deliver it with hope instead of despair will give someone such a better feeling of a life still to be lived instead of a life being over.
Absolutely, that's so important. I think that is key, isn't it? Giving somebody hope when they're diagnosed.
The medical model of diagnosis concentrates on what we can't do and also concentrates on what the clinician can't do. There is no cure. So to find the balance between the clinical and a social diagnosis would be far better for the clinician because they're offering hope, and far better for the person because they're receiving hope.
Yeah, that's a really important message, I think. So last question, how would you like to see service developers, commissioners make use of this more accurate data in the future?
Very simply, by acknowledging we exist. Currently, it's a postcode lottery of whether commissioners acknowledge our existence and therefore provide the correct services. By acknowledging we exist, they can see the need for the services.
Absolutely. What message would you give to them?
That we have a very different needs. To ask people already diagnosed, what would you have wanted? when you were diagnosed that you didn't receive.
Yeah.
Don't be afraid to ask. You have the Young Dementia Network full of people with young onset dementia. Use that resource.
Mm-hmm.
Don't think you know the answers. You're the experts by financial experience. We're the experts on financial need.
Absolutely. I think that's a really important message for people to take away, isn't it? Speak to the people with young onset, obtain their views, see what they need, what would they like to see change, what services do they need, what experiences would they rather have had when they had their diagnosis.
Absolutely.
Well, thank you very much, Wendy. Thank you for sharing your insights and experience today. It's been lovely to chat with you. Thank you.
Thank you.